Good afternoon once again. Today is Wednesday, May the 27th, 2020, and this is the English language summary of the daily press briefing of the Center for COVID Situation Administration, or CCSA. First of all, the spokesperson recapped that, of course, right now we're in the second phase, and soon, on June the 1st, we will be moving into the third phase, and after 2 weeks, eventually to the fourth phase. After that, around approximately the 30th or the end of June, we will be returning back to normalcy, but of course, under the new norms. So we hope that this plan will be working out, and we hope for the continued cooperation. Of course, we approach the beginning of the third phase very soon, the relaxed measures, and we hope to confidently make a transition to this date, which is the 1st of June. This afternoon, actually, there will be a meeting of the CCSA to iron out the various measures of Phase 3. And of course, as you all know now, the extension of the emergency decree has been announced until the end of June. The key word, of course, as the spokesperson had summarized, is integration of work of the ministries involved, and of course, the key word of public support in order for us to all fight off COVID. The spokesperson also mentioned about the various experiences of various countries around the world. Today also, we'd like to recap a message made to the general public yesterday by His Excellency the Prime Minister Prayut Chan-o-cha, made yesterday on the 26th of May, wherein the Prime Minister addressed the public on the economic impact of COVID in Thailand and his resolve to swiftly and promptly tackle the issue. The Prime Minister met with various representatives of the private sector in Thailand to seek out solutions for economic recovery. He also received many suggestions from the business associations, from the various business groups, including retailers, issues on SMEs, on tourism, on fisheries, and he thanked the public and the businesses for their resilience, despite the difficult situation posed. Of course, also, we are in the monsoon season in Thailand, and transmission of respiratory diseases, we mentioned before the seasonal influenza, seasonal diseases, usually happens during this season. So we'd like to give a gentle reminder to everyone to continue to, of course, wear masks, as it significantly reduces the chances of spreading COVID. Of course, washing hands, distancing when you go outside, regular sanitization of areas, establishments, and avoiding crowded places. So moving on to the general situation and numbers that we have for today, we have recorded for you today 9 new confirmed cases, all of which are Thai nationals who have returned from abroad. So the first is a national who has repatriated from the United States, a Thai male, two Thai males, aged 18 and 27. They all went to the state quarantine system in Chonburi on the 12th of May and were found to be infected on the 26th of May, and they were asymptomatic. That's the first 2. The third, it is one Thai male who repatriated back from Qatar, age 34. A spa worker who returned on the 22nd of May went into quarantine in Samut Prakan province. He was found to be infected on the 25th of May, and his symptoms were fever, 38 degrees Celsius, coughing, the loss of the sense of smell. And the remaining 6 of the 9 are students, Thai nationals, returning from the repatriation flight from Saudi Arabia via Malaysia. These 6 Thai male students are aged between 23 and 33, all went into the state quarantine system in southern Thailand, in Songkhla, Yala, and Pattani and Narathiwat provinces, and they were found to be infected on the 25th of May. So as you can see on the slide on screen, 9 new confirmed cases, making the total cumulative number 3,054 in Thailand. The total number of recoveries in the green box is 2,931. That accounts to almost 96% now of all the number of cases in Thailand. 96% of cases in Thailand have recovered or been discharged. And the remaining patients in treatment in hospitals is 66. No new fatalities for today, so the number of fatalities remain at 57. On the issue of compliance, yesterday's establishments, in terms of inspection, we have over 22,174, and a small number have not fully complied. It's very heartening, very happy to see the majority of establishments complying with the measures fully. We hope that the business clusters will keep up with the good work. It's important that they are committed to practicing hygienic standards prescribed by the CCSA and Ministry of Public Health. As of yesterday, there were also 116,175 business establishments who registered themselves on the Titana platform. As you recall, we launched the Titana platform over a week ago, and now more than 13.7 million people around the country have used the platform. So quite successful. We're quite happy about that. Around 34.8 million have checked in, and 23.5 million have checked out, with 13.5 million evaluations. Just to note that there are certain business clusters who have received the highest evaluation from customers upon checkout. And these business clusters, the 5 top business clusters that have the highest evaluation scores, were given to the businesses in the first is the television and movie set cluster. The second is the beauty clinics. The third, the health clinics and health centers. The fourth being the museums and libraries, and the last being the child and elderly care centers. So for the Titana platform, the web-based platform, now available in English. So we'll have on screen for you now just some examples. Actually, this is my personal experience visiting some establishments, actually a 7-Eleven, and choosing the English language option of the Titana platform. And as you can see, check in, check out, the menu is available in English, as well as the evaluation page. And the last on the right slide is thank you for completing the survey. So it's available in English, and of course, as mentioned yesterday, it'll be available in more languages in due course. Simple steps in checking in, checking out, and completing the evaluation. You all are advised to use the platform so that you can be promptly notified in case that COVID positive is found in the places that you have visited. Hopefully not, but if there is, you'll be notified duly, promptly. And it's vital, of course, in monitoring the spread of the disease, as well as in ensuring public safety and public health. The spokesperson also mentioned that the CCSA duly notes the various feedback regarding Titana that we have received so far, and we will be continuing to make the necessary improvements. Also, the CCSA will be introducing improvements to the platform in due course, which we will be making that information available to you. On the issue of Thai nationals, every day we update you on this. There was information regarding posted by the Royal Thai Embassy in Riyadh because the situation in Saudi Arabia might be of concern. The Thai Embassy in Riyadh has been informed that a Thai national contracted COVID, and a number of repatriated Thai nationals on the recent flight to Thailand were found infected. As I recapped just now, 6 of the 9 who came back from Saudi Arabia. So it's important to note that these Thai nationals have undergone the medical checkup as well as COVID testing before departing from Saudi Arabia, and the results were negative. And it's believed that this group of patients is from the new cluster found in a university in Riyadh, as many new cases were traced back to this area. So this shows that the new clusters of COVID are still emerging around the world. We have to closely monitor and not let our guard down. On the activities of Thai embassies and consulates around the world, just to note first that I mentioned earlier, there is also online consultation from various doctors who have assisted Thai nationals who are living abroad. So they have applications in order to provide the consultation, medical consultation to Thai nationals abroad. And the embassies have been utilizing this and advising the Thai nationals in countries, especially in countries that have a medical system that it might be difficult to access at the moment. So we have some images from the Royal Thai Embassy in Wellington, New Zealand for you today. The Thai Embassy in Wellington, New Zealand hosted a charitable event with the Thai community in New Zealand in cooperation with the Thai restaurants in the area, and they prepared Thai food boxes comprising not only of hot food and snacks, not only of food but also snacks for Thai nationals residing in New Zealand. We also have another image of another act of kindness. As you know, I mentioned this from time to time, of the foreign community helping Thais in Thailand. So this is from the Indian community in Thailand with the hashtag on social media, Thamdi Dai Di, Thamdi Dai Di food drive. It's a food drive that they held, which ended on the 13th of May. And they served close to 50,000 meals between the 30th of March to the 17th of May. So thank you very much to the Indian community. You have an image there. Thank you very much for that act of compassion, and thank you for the picture credited to the website in social media. Yes, so just to recap, of course, today's briefing, we remind you of the serious need to continue to keep your guard up and high. The spokesperson mentioned quite often that we're almost in the third phase, hopefully in 2 weeks, the fourth phase, and hopefully the situation will return back to normal. But of course, it depends on all of your contribution, all of your sacrifices, and all of your dedication. We're in this together. So hoping that we will confidently move on without fear of the second wave of infection and towards the third phase of relaxed measures. The third phase, of course, will be having many business clusters opening, and that will be announced in due course. So just in ending, I just have some quotables from the spokesperson and, of course, from the World Health Organization as well. First is from the World Health Organization. Dr. David Nabarro, the special envoy of the World Health Organization. And this is very nice to hear, just to quote, everywhere is different, meaning countries, everywhere is different. Demographics, access to health services, travel patterns for work vary by country. And the responses to COVID-19 work best when it is designed appropriately to the place where they are to be applied. End of quote. That is Dr. David Nabarro of the World Health Organization. The spokesperson also gave us some sound bites to think about. Of course, the key word right now is integration and cooperation between the public, the private sector, the government sector, the people, of course, and the country as a whole, the spectrum of Thailand and the world. So public, private, people, Thailand and the world. And the keywords of action are, of course, being serious, staying strong, being strengthened, having partnerships, and stepping forward. So, just in phrases, the public sector being serious, ภาครัฐเข้มข้น the private sector being strengthened, เอกชนเข้มแข็ง and the people engaging in partnerships, ประชาชนร่วมแรง and of course Thailand and the world stepping and moving on forward. ประเทศไทยได้ไปต่อ. Thank you very much for your attention, and we'll see you again tomorrow. Good afternoon. สวัสดีครับ